coming on, and so apologies for that. My name is Alison Solomon. I am the Senior Director for Professional Development at the Jamaica Teaching Council, and it is my pleasure to just open this webinar and declare it open and welcome you all. But before we do that, we want to start off with prayer. And with us today, we have our Chief Financial Officer, Mrs. Davette Crossdale-Bowen, who will be doing prayer for us today. And we want to welcome Mrs. Crossdale-Bowen to open with prayer. Mrs. Bowen?
Yes, good afternoon, everyone. Let us pray. Heavenly Father, most righteous God, we just want to thank you for life. We thank you for your love. We thank you for your grace. We thank you for your mercies. God, we realize that it's not because of anything good that we've done while we're alive. And as we gather to have this webinar at this moment, I pray, mighty God, that you be with us, mighty God. I pray, Lord God, that you bless the presenters, everyone that is gathered on this platform. God, I pray, Lord God, that you help us, Lord Jesus, in our discussions in how to make schools safe for the teachers. God, I pray, Lord God, that everything that is learned today will be implemented. And I pray, God, that you take full control. Go before us, God, open our minds, open our understanding, and help us to have a very successful webinar. In Jesus' name I pray, amen.
Thank you, Mrs. Bowen. And so today, teachers, as you see in the flyer or you heard in the prayer, we are going to be talking about making schools safe for teachers. And I am not the one who is going to be introducing the speakers to you, but I assure you, from a health perspective, to a school safety and security perspective, and a student perspective, we have some bases covered. We do hope that you enjoyed our little chit chat in the beginning for persons to state what decade produced the best music. And thank you for voting for 70s music, right? If I was to take a poll, a very biased poll, 70s music would have come out on top, all right? And so welcome, welcome, welcome all. Our moderator for today is none other than our Chief Professional Development Officer, Mr. Davion Leslie. And by now, all teachers would know Mr. Leslie. Mr. Leslie has been leading professional development for quite a while at the council now. And of course, with our G Suite training, you would have gotten to know him quite well. And he also comes in most of our training sessions. And so teachers are well familiar with Mr. Leslie. And it's good that when we talk about safety and security of our teachers, that you have somebody bringing you through this process that you are familiar with and that you know very well. And so Mr. Leslie is one of those persons. So I want to welcome and hand over to Mr. Leslie, who will go through the protocols for being in this webinar, which is very important. Please listen carefully. And please just sit back and let's have a good 2-hour session. Mr. Leslie, over to you.
Of course. Thank you very much, Mrs. Solomon. I had a little moment there when I was unable to locate my mic and my video on the screen. Forgive me, teachers. Greetings and salutations, everyone. What a time is it to be alive. Lord have mercy. Did you ever think that you would be living through a movie? And these days, that is how I think of my comings and my goings and just my daily life. Did you ever think that there would come a time when you were living through a movie? These days, to be frank, to get through these days, I'm reminded of what my mother would always say. You need the whole armor of God, I tell you. from, if it's not one thing, it is another, from natural disasters to the health crisis and all the different things that are happening. But aren't you just happy to be alive, teachers? Aren't you just happy to be optimistic, to have the audacity of hope? I tell you, there are so many reasons that we have to be in despair and to give up, to just throw up our hands in the air and say, boy, we can't bother anymore. This is it. But I tell you, we have the audacity of hope. We are here today talking about back to school. We're having conversations like these because we are assured that tomorrow will come. And even if the sun is not shining today, one day it shall shine. And so it is this kind of optimism, teachers, that I know you have, that I know we all possess. And we have this optimism in bucket loads. And so I am more than happy to welcome you to this session, to welcome you to this afternoon series of presentation. This is our third, and at the moment we are saying our final webinar in the series that we have had, that we are hoping to use to prepare you teachers, and I suppose even to prepare us as well as your support staff here at the council, to see the new school year, which we know begins in a few weeks. Well, I think it might be better if I say in a few days. And so we welcome you to this third and final webinar. If you have been joining us so far, you would have known that we spent the first week talking about self-care, mental wellness, and just mental health. We spent the second week speaking about the success stories, and what a webinar that was last week. We heard from 7 teachers working in the trenches, working on the front line, sharing their stories of success as they engage with teaching and learning during the pandemic. We were blessed last week by those stories. And this week, we're going to be talking about making school safe. And what a time to be having a conversation like this. This is perhaps the absolute best time for us to be having this conversation. We are now averaging about 14 deaths per day from COVID. We have long exceeded the capacity of our bed spaces within the hospital, those bed spaces that were dedicated to patients of COVID. We are typically in excess of 40% positivity rate each day. That is no longer shocking when it happens, because it has happened so often. I share something with you very briefly. Last night, as I was interacting with social media, I saw the Gleaner putting up a post on their Instagram page, and it's one of those breaking news alerts, and my heart jumped. I said, Lord have mercy, what is this now? This was near midnight, if not after midnight last night. And so when I saw it, I thought to myself, what kind of breaking news could we have at this hour of the night? And I was a little bit afraid to read the story. And as I clicked on the link and the story opened, the first thing I saw was that the Ministry of Health was reporting 21,000. And in that second, for at least 2 seconds, teachers, I tell you, I thought to myself, 21,000 cases of COVID. That is how I naturally finished the sentence that I saw. 21,000, I thought to myself, good God have mercy, that is shocking. But as shocking as it was, for a second or two, I thought that was possible. Of course, I was wrong. I was wrong. That was not the story at all. The Ministry of Health was reporting that 21,000 persons were vaccinated over the weekend, a record number. And so that was good news. But the point I'm making is that for 2 seconds, or at least 3 seconds, I thought they were reporting that there were 21,000 patients or persons who were diagnosed with COVID-19 yesterday. And I was shocked that I could have believed it, because I said to myself, good God of mercy, is it that bad? And so the point I'm making is that we know the numbers, we have heard the numbers, and we certainly are aware that we are living in a time where we have significant incidents of COVID-19 within the population. Even today, as I speak to you, I know of so many teachers in this space who have reached out to me privately to let me know that they have been touched by COVID-19. So many teachers who have said that one of the deaths that have been reported in the news, sir, is of a teacher from my school, or is of a teacher's brother or a teacher's uncle, and the school community that I'm from is in mourning. And so I want to reach out to those teachers in particular and just hug them mentally at this point to let them know that the council stands with you and that we lift up your name in prayer and we remember you and we send happy thoughts and sunshine and warm hugs and teddy bears and ice cream and snow cone and candy and all of those nice things. We are thinking of those nice things and sending them your way and just hoping that we can put a smile on your face and brighten your day. Even as I sit here today and I am thinking of how we have all been impacted by COVID. I got the news this morning that a teacher, one of our trainers who has worked here with the teaching council, was perhaps engaged some of you as teachers, as a trainer. One of our current practicing trainers died from COVID, I believe, yesterday. And so this is not something that is far away from us anymore. And teachers, I don't mean to be an alarmist, but I actually want you to be alarmed. I want you to realize that we are not within a time when things were normal and we could take it for granted that we will not catch COVID. Or if we catch it with a lot of mercy, it's just the cold. Delta is not like that. And so teachers, I am trying to alarm you into action to let you know that you have to be careful. And this conversation this afternoon is being held against that background, a background that says we want to ensure that we arm you with all of the information that you need to welcome Mrs. Solomon. I see that your camera is now working. Greetings and salutations to you. Right. And so we want to alarm you into action. We want you to be armed with the facts. And as we think about you going back into the classroom, even if not September morning, but shortly thereafter, we want to have a conversation with you about being prepared. And so this afternoon, as I pause to welcome all of my colleagues who are here in this space from the Teaching Council, I know Ms. Bailey is here. Ms. Drader Bailey is a member of staff here at the council. Ms. Bailey is a PD specialist. Mrs. Crossdale Bowen is still in the room. Mrs. Crossdale Bowen offered prayer for us. I know Ms. Solomon, you would have met her just now. She's also here. And I suspect there are other members of staff who I'm not seeing, but I just want to welcome them. And so without spending too much time with all of my preliminaries and everything that I perhaps may be tempted to share with you, I'm just going to very quickly introduce you to our first presenter. And I really want you to pay attention, to be minds on and eyes on as you engage with the first presenter. Well, all the presentations certainly, but absolutely with Dr. Ennis as she takes us through a session that we think is absolutely crucial for you as teachers. Dr. Melody Ennis is the Director of Family Health Services within the Ministry of Health and Wellness. If you have followed the news any at all over the last few days or weeks, if you have at all been on anybody's social media pages, if you have seen any of the alerts and the highlights, I am absolutely sure you would have met Dr. Ennis, at least the name. Dr. Ennis, by and large, it seems, has become the face for the COVID response in terms of the interventions and so on that can take place at the organizational and institutional level. Just a few days ago, not last night, but the night before, I was actually engaged with her on Twitter. I don't know if Dr. Ennis, you knew I was there, but I was listening to you as you engaged with the Jamaican public in very frank, open ways about the COVID-19 virus and the vaccine. And so teachers, today I can tell you, we are more than blessed. We are privileged really to be able to have gotten Dr. Ennis to dedicate her time this afternoon to speak with you. So I'm going to ask you please to give her your full attention to ensure that you prepare the questions that you may have. She is one of the more engaging presenters, and she is quite prepared and quite ready to take on your questions. I'm going to allow Dr. Ennis to determine how she proceed with her presentation, whether she wants to engage you with questions during or afterwards. She will alert you of those protocols, but we are here to support Dr. Ennis in the chat and also to ensure that your questions can be taken over the mic if she wishes. Dr. Ennis, I want to welcome you to this space and thank you in advance for the way that you are going to engage the teachers. Dr. Ennis, are you there?
I am here. A pleasant good afternoon to everyone. Thank you so much for the invitation. I am just tweaking to see if I can get my presentation up. I have just a itsy bitsy teeny weeny disclaimer, and it is really that for us all to be healthy, we must take this holistic approach. For our schools to be safe, it's everything that needs to be involved. But my focus this afternoon is going to be on what? It's going to be on vaccines and how vaccines can help. So I apologize in advance that I may not touch on the spiritual aspects. I may not touch on the financial aspects. I may not look at infrastructure. I'm looking mainly solely on vaccines. So forgive me. And I was toying with how I should proceed with this engagement, if I should do a presentation or I should just take question and answers. But I'm going to start off with a presentation, and then, of course, the best part of this discussion this afternoon will certainly be the questions from the team. So I'm going to share my screen now.
Right, we're seeing your screen, Dr. Ennis.
We're seeing my screen. However, I would not like to say the end. I'd like to say let's start.
Right.
Yeah. All right. So we really are trying to get to the point where September, October, our schools are safe. And vaccines are where we are. And are we vaccinating or are we really just vacillating? What are we doing and why? And a little background is always important. It's not a lot of history. It's current history because it's just about a year or plus of the fear, the anxiety, the abuse, the loneliness, the separation. Of course, pertinent to us this afternoon, the fact that schools are out. But overall, we have been in anguish over the last year. And medicine, which is supposed to help us out of these kinds of dilemmas, not really cutting it. We have used every medication, antiretrovirals, we have used antibiotics, we have used, we're at ivermectin now. But what has happened? Up to yesterday, the latest data is that we have over 230 million persons infected. And more importantly, let's just look at the deaths. 4.46 million persons have died. Now, that is way in excess of Jamaica's population. Needless to say, if COVID had only affected us here in Jamaica, we would no longer be, much less to be sitting here to talking about how we can make our schools safe. So we are at vaccines because vaccines have helped us to make our schools safe over the years. It has helped us to make our country safe, our region safe over the years. And we're talking about over 200 years now. And we know for sure that vaccines remain rigorously tested. We know that they're one of the medications that once it's on the market, it continues to be monitored. And we wonder why. Because we're giving vaccines to who? To healthy children, to healthy adults now. So if you give a medication to someone who is healthy, you expect them to stay healthy. And that is why it is absolutely important for us to monitor vaccine and vaccine delivery across the world even after they have been approved and certified for use. We also know that because vaccines are preventative, well, that's what they are. They prevent us from getting severely ill, getting hospitalized, dying. They prevent, and therefore the cost is much less than when you have to treat and cure. So it really is the best buck for your money when you invest in vaccines and immunizations. We have accomplished much. We have been able to eradicate smallpox. We have been able to save the population of Jamaica every single year through persons across the globe getting vaccines. We now have measles in only about 12 countries. I'm not sure how many persons are old enough on the platform to remember when we had just one imported case, and the kind of tizzy it ran through the society to try and catch everybody who may be exposed, because it is so contagious and it affects our children in such a bad way. They may become deaf after getting it, so they might die. Of course, some will die, but those that survive, they may be deaf. You understand the impact that is going to have on them throughout life. We don't have polio anymore, and vaccines are now being used not only for infectious diseases, but what? For cancers. And, we should be proud of our history here in the Caribbean, because we have been the leaders as the region, or as being part of the region of the Americas. We were the first to eliminate smallpox in the world. Yeah, not even where the big, great countries are. We were the first to become polio-free. We were the first to introduce the pneumococcal vaccine. If you all take your children to get the vaccine against respiratory illness, we were the first to introduce the rotavirus. And when we spoke of cancers a moment ago, we're still the first region to have introduced the HPV vaccine. So we have always over the years embraced vaccines. So what are vaccines? Why do they work so well? Well, they stimulate our bodies to do what? To produce antibodies. And antibodies are simply germ-fighting tools. And these germ-fighting tools help us to produce a quicker and stronger response when invading organisms enter. They help our bodies to resist, to fight off, to withstand, to counteract any infection or toxin that may try to wear our bodies down. So, I continue to liken our immune system to the defense force. The soldiers at camp, there are many of them having various functions, but their overarching role is to do what? Protect this little rock called Jamaica. And in order to do so, they have to gather intelligence, no so? And they have to understand the strategies and tactics that the warriors might come with. Are they coming via air? Are they coming via sea? Are they infiltrating our lands? Yeah, and based on all of that intelligence, the soldiers can go to camp and make their ammunition. They can have their air fleet, they have the Coast Guard, and they're on the lookout, on the alert for anything or anyone that may try and what? Do something to our sovereignty. So yeah, that's how the soldiers operate. Our bodies operate pretty much the same way. We have white cells in the body. These little soldiers, they're running up and down in the cell, in the circulatory system, and they are looking out for any germs that come in. But they too need to gather intelligence. They need to get a sneak preview of how the germ is going to look. And that is what vaccines do. Vaccines provide this sneak preview to say, yeah, when I come in, and they go back and they make their ammunition, yes, so that when the germs come in, because they have what we call memory and they have been sensitized, then they can defend us to the teeth. We have several different types of vaccines, ladies and gentlemen, that we have been using for over 200 years. We have the weakened version, which actually utilizes the virus or the bacteria. Excuse me. It utilizes the virus or the bacteria, but it has weakened it so that it kind of impotent. It's not really going to do us anything, but it provides us with a strong immune response. And we've all on this platform, if we're Jamaicans, taken the measles, mumps, and rubella vaccine. And that is one of the weakened versions of the virus. Then, of course, we also have the killed virus. So this time they kill it, purify it, put it in a vaccine. And we have the polio drops, influenza that is offered every year. And again, if we're all Jamaicans, we would have had the polio drops. And if we're old enough, we know that there was a slight polio scare somewhere in the early 80s, and everybody did line up at school, open their mouth, drop, nurse drop something on you. Yes. Then we have our all-time favorite vaccine, and that is the tetanus shot. We know it's our favorite because every Sunday morning when you're in the kitchen and cooking and the knife cut you, there endeth the cooking because you're running to some doctor at some place to get your tetanus toxoid injection. Cause what? You're afraid of lockjaw. And then, of course, not to mention the fact that if a rusty nail even just brush past you and scrape you, that is, of course, the gospel that you must get lockjaw and you have to get your tetanus toxoid injection, which is simply a vaccine that utilizes what? The toxins that the bacteria or the virus produces. We have some other vaccines now. As the technology increases over time, we have learned to use different parts of the virus or bacteria to make vaccines. So we have those that use the subunit, some that use recombinant therapy, all of these big words. Let us use a little piece of the virus or the bacteria or the outer coating of it or some portion of it to make the vaccine. And we have the hepatitis B vaccine, the Haemophilus vaccine, the human papilloma virus vaccine utilizes this kind of technology. And of course, these vaccines are important. We know that here in country, children below the age of 7 must be immunized by law. And that is what? That is not only to keep them safe, it is to keep the society safe, to keep the schools safe, to keep those who really cannot be inoculated or vaccinated safe as we provide herd immunity. All right, so the other thing is that, these vaccines contain preservatives, and these preservatives are going to damage us. And that is not so, because the preservatives in the vaccines, the additives, are the similar ones that we find in the foods that we eat. So you have some things called stabilizers, which really help to prevent chemical reactions from taking place. You have other substances that keep the ingredients blended together, preventing settling and clumping. I like surfactant, and I'm sure most of us on the platform likes it too, because it is what we put in ice cream. And we all know that we like that smooth, silky ice cream, like the Devon House one. And that's the one we'll stand in line, even in COVID, maintaining distance for half an hour to get the Devon House ice cream or more. But if we were to purchase the ice cream and it's like milk powder, grainy, we're not going to buy it again. Now, what makes it smooth and silky is surfactant. So you understand how much ice cream you eat over your lifetime as opposed to one jab from a vaccine. It's not doing us anything. No problem at all. We have residuals. Residuals are not active ingredients. Egg proteins, yeast, and antibiotics. Very, 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 very small quantities. We all eat egg. We all drink wine, yeast in it. We all take antibiotics at some point. But look at the quantities here. Parts per million, parts per billion. Not causing any problems at all. Then we have something called diluent, and that is just a fancy word for water. It is sterile water. Yes, we have most of the vaccines come as a powder, And guess what? We want to get it into the injectable form. So we have to mix it with something, and we mix it with this diluent sterile water. That's it. Adjuvants. Adjuvants are other additives, but these now help to keep the vaccine at the injection site. So this is the point of the arm where you get the pain and the tenderness, because what? It is stimulating the immune cells to tell us that, yes, something foreign is there. I have recognized it, and I am mounting my response so that I can go back and make those germ fighting tools. You have a little bit of aluminum salts in some of the vaccines, and again, no health problems, because it is the same quantity or less that is found in the foods that we eat and drink every single day. Now, a lot of persons are concerned that, we're not going to take the vaccine because really and truly, the vaccines were made too quickly. The vaccines cannot be good. Something must be wrong with them. And I want us to just look at Vaccine Development 101. Take a listen, and we'll have a discussion after.
How do you create a vaccine to fight a new disease? And why does it take so long? Well, first, you have to identify the virus or bacterium that causes the disease. In some cases, the pathogen itself can then be weakened or deactivated and used to make a vaccine. But this isn't always possible. In these cases, the next step is to identify the pathogen's antigens, unique protein or glycoprotein markers which can form the basis of a new vaccine. For some pathogens, these antigens always stay the same. Other pathogens, like the virus that causes flu, can change or mutate their antigens, and so these must be reanalyzed every year. Once you have identified the pathogen or antigens, you need to decide how you are going to use them to build a vaccine. This is called the vaccine platform. There are a lot of options here, like subunit vaccines that only use part of the pathogen. There are also newer or more experimental technologies, like viral vector or nucleic acid-based vaccines. But we'll get to these a bit later. You also need to decide how the vaccine will be administered. By injection into the skin or muscle, orally like the polio vaccine, or through the nose like some flu vaccines. Each of these options could affect the response the vaccine induces. For now, let's say you've decided on the platform and designed the vaccine. Next, it needs to be tested, first in cell cultures and then in animal models. This might include challenge studies, where animals that have been given the vaccine are deliberately exposed to the target disease to see if the vaccine protects them. Further down the line, and if the disease isn't too serious or effective treatments are available, humans might take part in challenge studies too. Once the vaccine candidate is proven safe in animals, you need to prove you can manufacture it to a high enough standard for people and at scale. This is called GMP certification. If the vaccine passes all of these stages, it's time to begin human trials. Normally, these come in 3 phases, and they all have to be passed. First, the vaccine is given to a small group of healthy people to test for adverse reactions. This is called the safety trial. Second, you give the vaccine to hundreds of people to work out what dose is needed to trigger a big enough immune response. Finally, you can trial the vaccine in thousands of people to see how effective it is. This step is often the slowest, and participants are sometimes recruited around the world. Researchers have to wait for participants to come into contact with the pathogen naturally. By tracking how many become infected, they can work out how effective the vaccine is at protecting the group. It can take decades to gather enough data to be sure. But if you do, the vaccine can finally be licensed. There are still problems to overcome, however. Mass producing a vaccine to a high standard can be a difficult job. And once you've cracked production, you still have to deliver the vaccine to where it's needed. And then there's phase 4 monitoring, keeping track of rare adverse reactions that the vaccine might cause even though it's passed the previous trials. This trial process is very safe, but that comes at a cost. It is also very slow. In an emergency, there are ways to speed things up, like reducing the time spent waiting for paperwork to be completed, or running different trial phases at the same time. But steps are never missed out. By working more efficiently, a protective vaccine could be produced in as little as 12 to 18 months, and advances in biotechnology could speed up production pipelines as well. And there are more ways we could speed up production. Let's come back to some of those newer vaccine platforms. Nucleic acid vaccines don't use pathogens or antigens directly. Instead, they deliver the genetic templates for the antigens. These DNA or RNA templates can be delivered directly or in lipid nanoparticles that help them to enter cells and improve their stability after injection. These nanoscale fat droplets encapsulate the RNA or DNA, protecting it as it enters the body. Some lipid nanoparticles can also act as adjuvants, molecular triggers to kickstart the immune response. Once inside the body, these DNA or RNA templates instruct our cells to start making antigens which activate the immune response needed to build immunity. RNA and DNA are much easier and faster to produce in the lab than antigens are. They're also potentially safer than vaccines that contain whole pathogens. That means they could hopefully be used by people with weakened immune systems. But nucleic acid vaccines are still experimental. Another approach is called a viral vector. Viral vector vaccines work by inserting an incomplete segment of genetic material from a pathogen inside a harmless virus that doesn't cause disease. This then acts as a vehicle for the genetic material, delivering it to the right place in the body where it can be translated into proteins, triggering the immune system. The viral vector may even be self-replicating, increasing the amount of vaccine in the body. Viral vector vaccines are also quick to produce. Safe vectors have already been established, and it is relatively easy to insert different target genetic material into these established carriers. And as the genetic material inserted is incomplete, they can't replicate and cause disease, so they're also very safe. But there is only so much the process can be sped along. Effective vaccines can save millions of lives, but before they are used, they have to be proven to be safe and effective. In the future, researchers hope to develop vaccines against non-infectious diseases, like cancers, based on chemical markers called tumor neoantigens. Vaccine technology is developing every day, and it has a bright future, albeit a slow and methodical one. How do you...
So we know that vaccines really are safe. They have to go through rigorous testing, passing through the various phases, and they can't get to the other phase without the one before being successfully passed. You know, you can't move from one grade to the next, or you shouldn't, until you have attained, you have matriculated. So you have to be safe and you have to be effective to move on. So we know all of this. So what exactly is holding us back? What is it? Well, fear. Fear is a big thing. And what is compounding our fear certainly are the conspiracy theories that are just running wild. We are bombarded with misinformation. It is coming at us fast and furious, and we are unable, really, we are unable to process all of this and to decipher and to decide what is really correct. And that is really throwing us into a tailspin and preventing us from accepting the help to stop this pandemic, which vaccines offer. There are, of course, persons who have religious beliefs that we really need to just have a one-on-one with them to explain what this medicine really does. We have persons who don't know why them don't want the vaccine. Them just don't know, really and truly. And then we have the business of family and friends. You know, those people who always telling you something, especially those that they are foreign, And chances are the foreign people, them don't take the vaccine long time. But we have our family and friends which will, try and dissuade us. And then there are others of us who just don't have any trust in the system. We hate big pharma and they might try pressure people and all of that. And it is holding us back. But, we're going to try and bust some myths or burst some myths. I prefer bust the myths. Let's bust them up. Right. So the first one really is that the vaccines have been made too quickly. And we recognize that that is not so. There were ways, organized ways to get it done quicker. 1, money. 2, collaboration. This business of sharing of information. No longer was I keeping my trade secret because I want to get some prize. I was able to share it with my Russian counterparts, with my Chinese counterparts, my American counterparts, and you can achieve so much more together. So information was shared. All the tests that were done from 10, 15 years ago, looking at MERS and SARS, which of course are cousins in the coronavirus family, all of that was brought to the table to say, hey, this is the foundation. Can we just build on it? And with all of that knowledge and with money, then it was possible. But of course, no steps were skipped and the rigorous testing continued. I particularly like phase 3. I like the phase 3 trials because it is the one phase for me that would be a challenge. It takes about 10 to 12 years to complete phase 3 trials. So if I am telling you that the vaccines are safe and effective, and now I'm telling you 10 to 12 years to complete one phase, one of how much? 3 phases. And I'm telling you it was done last year in 6 weeks. How is that possible? It is possible because for phase 3 trials, you need to get thousands of persons across the world, different age groups, different race, ethnicity, whatever, has to be diverse. But guess what? All of these persons must come in contact with your disease so that you can use your vaccine. All right. So over the years, that was not possible. You didn't have the disease everywhere in the world affecting everybody. So in the pandemic last year, it was not hard to find thousands of persons. AstraZeneca, 40,000 persons in this trial. Moderna, 30,000. Sinopharm, 100,000. Pfizer, 45,000. It was easy to find persons who were in contact with the disease who you could use your medication on. So this phase alone moved from, say, 12 years to about 6 weeks. And that's why I like that phase. I think it helps us to understand that we have not been shortchanged in any way in making these vaccines. All right, so let's get on to some other myths now. The one about altering our DNA. And if I take this vaccine, I'm going to turn into some other person. I'm going to grow some extra hands and feet. Well, I'm sure everybody on this platform knows of someone who have taken the vaccine. We have inoculated over 400,000 Jamaicans. And I am sure that they all look the same. They have not changed because the messenger RNA technology, the viral vector technology, simply instructs ourselves to make the spike protein that's found on the coronavirus, which is going to allow our bodies to generate those germ fighting tools. It or they do not in any way, shape, or form alter our DNA. They do not get inside of the nucleus. They are quickly removed from the body once their message is translated. So no DNA altering effect at all. Then we have this one that is really taking over the world, that the vaccine has some sort of tracking device because, all governments of the world, of course, have colluded and they need to know every single time me, Melody Ennis, goes to the bathroom and poo. It's important to track me. Well, apart from sounding a little bit over the top and to recognize that if governments really wanted to track us, we are allowing them to track us easily because we use a cell phone, which we do take to the bathroom, by the way. And we do have our laptops, we do have our smart, what they call it now, the smart watch, everything. So if they wanted to track us, you think they would spend billions of dollars for a vaccine, and we are allowing them, because we purchase all of these things, we are allowing them to do it for free. But let's get back to the science. There really is no microchip that is present in the vaccine. The vaccine cannot gather your personal information. The vaccines really simply just protect us from disease. That is all they do. But we do track, and we have always tracked and will continue to track. We track the cold chain, we track who makes the vaccine, we track which batch it was made in, we track the lot number, lots of things we track, because what did I say? We give vaccines to healthy persons. So if 100 of us take a vaccine today, and I am the one that comes out and said, I am sick, this is what the vaccine did to me. Now, I need to, the health facility needs to find out if the other 99 people, them having the same problem. And they pull them, excuse me, they pull them, they look at the manufacturer, the batch number, which nurse give it, which facility gave it, what were the conditions. If the other 99 people, them sick and popping down too, of course, it may be the vaccine. But suppose the 99 of them is all right and is me one sick. Chances are it's not the vaccine. So we do track, but we don't need to put anything inside of your arm, no microchip to track anything. All right, so the COVID-19 vaccines were developed using fetal tissue. This is a sticking point for a lot of our religious colleagues who, of course, have challenges with blood products and tissue, and whether it come from pig or not. Well, the vaccines do not require any fetal tissue. They don't require any animal tissue at all. And to just be clear, look at the components. So we have all the vaccines here in country now that is helping to keep the country safe. We have the Astrozeneca, which is now the grandfather, because we have it a long time. The first recombinant, replication deficient adenovirus vector, all of that is the viral vector technology. Remember that little shell, and then they're putting the little genetic code in? Yes, and it is inert, it can't replicate. That is what the first one is as an ingredient. And then we have proteins, the histidine, those are amino acids. We have some salts like magnesium and sodium all the way down at the bottom. Then we have polysorbate, which is just an emulsifier, help oil and water mix, little alcohol, some sucrose. That's it, water for injection. No parts of any dead baby or any pig or any other animal tissue for that matter. And Pfizer is here. Same thing, 4 main ingredients in Pfizer. The modified messenger RNA that encodes. We have fats in it, we have salts in it, and some sugar. That's it. Johnson & Johnson, more salts, same polysorbate, a little alcohol that makes up the Johnson & Johnson. No dead baby at all. The COVID-19 vaccine causes infertility. Of course, they might try to kill off Black people. That's why they might make this vaccine. Nothing is further from the truth. There is no medication that is willfully made that can impact a person's ability to conceive. Now, again, the science tells us about the syncytin 1 protein, and I've stopped using the science. Honestly, I've stopped using the science, and I'm just using observation, what I'm seeing. So we noted that persons who were in the trials last year have delivered healthy babies. But I come right ahead. We started inoculating in March, 10th of March, and persons came back for their second dose of AstraZeneca, and guess what? They were pregnant. So I just put this infertility one to rest. I have already been diagnosed with COVID-19, so I do not need to get the vaccine. Yeah, I get it already, I don't need it. Not so, and that's simply because natural immunity actually gets less over time, it wanes. And persons will have the disease, them get better, proper, and then get them pop down again, and the second pop down may lead to death. So they are encouraged, it is recommended that you take the vaccine. Then now you have that you can get COVID-19 from the vaccine. Is the vaccine giving me the disease? Well, remember, I just showed you what the vaccines were made of. So if it's not a part of it, if it's not in it, if it don't make it up, then how can it give it to us? Really now? So we can put that one to rest easily. Then you have, once I receive the vaccine, I will test positive. We could use the same line of argument to say if it's not in it, a part of it, it can't cause it. But let's look at this one a little closer. Remember, you're hearing about all the different kinds of tests. You hear about antigen tests, you hear about PCR tests, about antibody tests. So if you do an antibody test, remember, you're looking for the germ fighting tools. When you're taking, what the vaccine do? It helps the body to make the germ fighting tools. So if you do an antibody test, of course it is going to be positive. Actually, you want it to be positive, that's all, because it means that you are now developing protection. But the vaccine don't give you the virus. Okay, so we can easily move on from that myth as well. The COVID-19 vaccine has severe side effects such as allergic reactions. Of course, the vaccines may have and can have side effects like anything else. Persons are allergic to what? Shellfish and peanuts. Of course, you can have an allergy, but it is rare, few, and far between. And we do know how to treat allergies. And if you do have a severe allergic reaction, we're not going to give you the second dose. Just as if you're allergic to peanut the first time you eat and you swell up like bullfrog, you can't breathe and you go to the doctor and they treat you. You're going to stay away from peanuts. You might led to say, no, peanut allergy, don't it? So we understand that these things happen and we know how to manage. Then you have natural immunity. We don't contaminate my body, natural all the way. In order for us to get natural immunity, we would all have to get infected. 4 point how much million people dead already? 4 point how much million people dead already? So while I try to get natural immunity, which I just said wanes anyway, we could die. So why not take a vaccine that can build your immunity without the damaging effects of COVID-19? Once I have the COVID-19 vaccine, I no longer need to wear a mask. What's the point of taking the vaccine? I still have to wear my mask. I still have to hand wash. I still have to physical distance. Of course you do. Yes, you do. Simply because the vaccines protect you. And we are not selfish persons at all. So when I take the vaccine, I am protected. Yes, I won't get sick. I won't go to hospital. I won't die. But I can still infect you. You don't get the vaccine yet. So you can get sick and you can need a hospitalization. Okay. So until we get to that point of herd immunity, where enough of us are vaccinated. So when brother Corona hit me and then bounce off to you and somebody else, it can't take root, it cannot, and it is going to die down. We're all vaccinated. All right. And it is only at that time where we can consider relaxation of the measures. Everybody have something to say about the different times, everybody hit out AstraZeneca. Jamaican government took AstraZeneca because it's a good vaccine. It has been approved by the World Health Organization and it works. It's 79% effective at stopping symptomatic disease. Now, you may have listened to the testimonials of persons who tell you that it's not a nice feeling when they can't breathe, when they can't move, they can't taste, they can't smell. No. So it's 79% effective at that. But guess what? It's 100% effective against us falling ill, needing to be hospitalized. Hello. The hospital, them don't have no bed. And it don't make sense. You fly go a foreign hospital don't have no bed either. So if you can take something that can prevent you from going into hospital, wouldn't you? All right. So J&J is here. Yes, it is. Of course, look at that. Hospitalization will prevent hospitalization. 93% of the cases. That's a good percentage. That's an A, don't it? It's an A. All right. Pfizer, 95% effective. Another A. Yes. So what are we hesitating about? All right. Who should take the vaccine? We all know that now is everybody over 18, but of course, Pfizer is unique and special. It is given to children 12 and over. Who must get it? Well, we're offering it to everybody now, but guess what? We still are concerned and very concerned about persons with comorbid conditions. So if you are obese, you should take the vaccine. If you have any heart problem, heart failure, angina, hypertension, guess what? You take the vaccine. Respiratory disease, emphysema, bronchitis, asthma, yes, you should take the vaccine. If you have sugar, yes, you should take the vaccine. If you're HIV positive or otherwise immunocompromised, if you have any autoimmune disease like lupus, multiple sclerosis, rheumatoid arthritis, yes, you are to take the vaccine. Cause and why? If and when you get COVID, your outcome is not very good. When you look at the over 1,000 persons that have died, the majority of them have some underlying condition. Their immune system is not strong and it buckle and succumb to what? To COVID. All right, so we talk about who mustn't get it already. If you have an allergic reaction to any of the components or ingredients. Therefore, ladies and gentlemen, if you're allergic to penicillin, if you're allergic to shrimp and lobster, you can still take the vaccine because those are not components of the vaccine. Right. Side effects. This is what we should all be interested in. Of course, the vaccines have side effects, but we have some very, very common ones. Pain and tenderness. Of course, if I am joking you in your hand, your arm, of course, you will feel like a pain. So you will expect pain, tenderness, warmth at the injection site. All right, you might feel unwell. You can feel like, very, very tired. You can get chills, headache, nausea. We expect that in greater than 1 in 10 persons. Common, but up to 1 in 10, lump at the injection site. I beg you, if you don't feel the site, you're not going to feel the lump. So stop feeling it up. So lump at the injection site, you can get a fever and flu-like illness. And less common, 1 in 100 persons may feel dizzy, they'll get decreased appetite, abdominal pain, enlarged lymph nodes, or your wax and canal all over the body. They may have some sweating, itching, and a rash. Now, all of these things we expect, they go away within 24 to 48 hours. If you're unfortunate, them last for 72 hours. And guess what? This discomfort is a good thing. The body is recognizing the foreign agent and doing what? Making the germ fighting tools. All right, so we have the rare occurrences that we have seen. And for AstraZeneca, we know that they talk about the blood clots. Yes, you may get a blood clot after taking the AstraZeneca vaccine, but look at the statistics. 1 person may get a clot in every 250,000 persons. So we have 3 million persons in Jamaica. So if 1 person were to take the AstraZeneca vaccine, 12 may get a clot. We look at baseline data. We have more than that happening without the vaccine in population every single year. But then just look at the oral contraceptive pill. Ladies, we take these pills every day from age 18 to about age 45. Look at the incidence. 1 in 2,500 of us can get a clot if and when we take the pill, but we swallow it every day. Even sometimes when the doctor tells you you're over 35, you smoke and you're obese, walk away from the pill, you'll get a clot. We still take it. The risk of taking the AstraZeneca vaccine and developing a clot, the benefits way outweigh. Guillain-Barre is what we hear about with Johnson & Johnson. Yes, it can happen. Guillain-Barre happens normally in our population. The cause is usually unknown, but look at it with J&J. 200 people out of 12 million, almost 13 million persons got Guillain-Barre. So, again, it can happen. And by the way, we know how to treat. Yes, Guillain-Barre usually resolves spontaneously. It may cause death, but the number of persons that die from it is extremely small. All right? And we do have it generally in the population. Then now, this is the big one, myocarditis pericarditis. Why? Because this is the one we see with Pfizer, and this is the one we're giving to our children. Myocarditis and pericarditis, this is inflammation of the muscle of the heart, the tissues around the heart. Now, viral infections causes myocarditis and pericarditis. The COVID-19 can cause it. In our children that has had COVID-19 and hospitalized, about 28 of them have had myocarditis and pericarditis, and we have treated them and they're fine. So you can get it with the vaccine. We have seen 674 reports of when I took this down, it was over 2 million persons receiving the Pfizer vaccine. And we got 674, no deaths. It resolves spontaneously with bed rest and fluids. All right, it affects mainly younger persons, adolescents between 16 and 30, and men are more prone, but it is very, 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 very rare. So 600 out of almost 3 million persons. All right. So we see that the COVID-19 vaccines, they're safe, they're effective. We know they save lives. They can and will allow us to get back to normal, our countries to open back, our economies to get back on track. But it cannot happen unless persons get vaccinated. It cannot happen unless we get to herd immunity. So we're still into the watch, wait, and see. For what? What we're watching to wait and see. I could understand watching and waiting to see December or January when it just starts. But now that we have vaccinated 21% of the world getting one dose, 24% fully vaccinated, over 5 billion doses administered. What we want to say, billion people. What are we looking or hoping to see? Jamaica, we have inoculated 492,069 persons, and that was as at before I started this presentation. First dose, 252,000. Second dose, over 138. Trying to get to 65 to 70% of our population. We're not close at all. But these persons, importantly, are still alive and with us. Them don't dead, them don't turn into no other person. They are getting pregnant and impregnating other. They're good. Pfizer, this is for us. We're into the classroom. And of course, we want to ensure that it is safe for the teachers and for the students and anyone else. So we're at Pfizer. Over the 4 days, we managed to give just over 56,000 doses of Pfizer. For our children, 12 to 18, 27,000. But we had expected that it would be half and half because what we say, we're giving it to the child, our children, and their parents. So we expected half and half. But I want teachers to step up to the plate. Teachers need to step up to the plate to take the vaccine because guess what? The children may get the virus and transmit it. Not do we pity them, you know, by and large. Then cough 2 days, fever 2 days, run up and down, and they're good. But guess who's going to be sick? The teachers. Worse if you're obese, worse if you have underlying conditions, and if you have the same thought, or persons in your household have the same thought that you're not taking the vaccine, then you just carry it home to your old mother and grandmother. Okay? And you understand the outcome of that. So, of course, the invitation, the olive branch, everything is extended for everybody to visit a site to get vaccinated. We have a drive-through facility, 1 or 2, you know, for those who can't bring them grandmother out. In the crowd, you can just drive through. We have one site. We know how to make our appointments, www.moh.gov.jm or 1-8881-LOVE. We know what we must carry. The ID. If we don't have no government issued ID, you need a letter from a justice of the peace, your TRN number. If you take the first dose already, don't forget to carry your immunization card. You're carrying the kids, remind the parents, they must carry the birth certificate or the school ID. Yes, we have to. And once you get to our sites, of course, it's a bit crowded now because we just now schools proper, but we are going to inoculate you once you're there. You'll be registered. You'll get a little counseling, a little one-on-one talk so that, we can allay all the fears. Then we're going to give you your jab. You're inoculated. We look at you, keep you for about 15 minutes. Of course, if you give us any history of any allergy or any other, weird and wonderful condition, we're going to keep you for 30 minutes. You get your card. You're good to go. We give you a little pamphlet, even though we know we're not a reading society. We give you the little pamphlet so you can go home and put it up on your fridge to say, yeah, these are the side effects I expect to get. Now, after taking the vaccine, we don't know, we must wear a mask, we must hand wash, we must physical distance because, and say what? We need to get to herd immunity. And of course, even though I made a disclaimer, it is important that we practice living a healthy lifestyle. We've got to sleep right. We've got to eat right. We've got to stay connected. We've got to look after our welfare. All of that makes us healthy and can withstand this. So now, if we take the vaccine, we're going to be able to do all of them things that is on that slide, but we'll be able to go back to school. Schools will be safe. Our children will be learning. Outside of the children learning, don't forget the importance of socialization, right? Remember that schools are a safe space for a lot of our children. Let us not deny them this safe space. Let us allow vaccines to help. Thank you so very much. I'm going to hand over to the chair and open the floor with your permission for the discussion. Thank you all. I'm not hearing you, sir moderator.
Oh, I'm sorry. I'm sorry. There are multiple ways that I can mute myself on my device, and I had engaged more than one way. Forgive me. Well, I was thanking you, Dr. Ennis. I was thanking you for a comprehensive presentation that sought to address all the issues related to vaccination and to provide the information that I know the teachers would need in order to make informed decisions. Teachers, I have disabled the chat as I find that it is being used to spread misinformation that we are not able to challenge at this point, simply because we are not in a position to respond to all of the comments in the chat. Those persons who I know would have been posting heavily in the chat, you are free at this point. If you wish to share your views or to ask questions, you are free at this point to engage Dr. Ennis so that she can provide some clarification, and might I even go as far as to say some corrections to some of the misconceptions that you may have, some of which I know she has already addressed in the presentation. And so I'm hoping that we'll be covering new grounds with the question and not necessarily treading the path that we have already trod. But I just want to again thank Dr. Ennis and just to ask her to stay with us a little while longer while we try to get through some of the questions and address some of the concerns. Ms. Carter, your hand has been up for a while. I'm going to lower it. Well, not Miss, and as AJ Carter, I don't know if you're a Miss or a Mr., forgive me. I have lowered your hand. And if you wish to ask a question, well, since you have put it back up, I'm just going to allow you now to go ahead and ask your first question or make your first comment to Dr. Ennis. AJ Carter, you are able to speak. Go ahead.
Greetings, my friends.
Greetings.
All right, so I've been trying to speak since the last few conferences, meetings, but I was not given an opportunity to.
Sure.
So today I hope that I'll be allowed the opportunity.
Well, just certainly have that now.
My questions, I would like to have just a short discussion with the doctor, just to clear up any form of misconception I may have. I'm open to the idea that I may, whatever I know is just within my sphere of knowledge, and there is a lot out there for me to know. I would like to put this out there as well, as the doc has put through her disclaimer. that I am not an anti-vax, none at all. Okay. Matter of fact, I believe more in the science than I do in religion. However, I do have a few concerns. So my questions will be to the doctor today.
Right, we're waiting. Go ahead, man. We're hearing you and anxious to hear your questions.
All right, great. So I have some questions on my own, but also some from what the doctor mentioned. You mentioned that the vaccines have gone through rigorous testing. However, there was an emergency release of these vaccines. Could you explain that? If it is a case that the vaccines have gone through rigorous testing, why would we need to emergency release the vaccines?
Dr. Ennis, if you're speaking, we're not hearing.
I understood clearly.
Emergency use authorization, that term means that medication that has been used for other uses can be used in an instance, or new medications that have been developed can be used. It's a special term that is used whenever there is a crisis in health, in a pandemic. Now, just for information, when they do clinical trials, under normal circumstances, they utilize about 5,000 to 10,000 persons in the trials. With these trials that were conducted, much more persons were in use because of the nature of the illness. It was a pandemic. And therefore, it could easily be, the evidence was there of its efficacy, of its effectiveness, and therefore it was in emergency use. We can rest assured now, 2 years ago, the vaccines, the first one, and in short order, all the others will be granted full approval because the evidence is there, the effectiveness and efficacy, as we knew would come, is coming to the fore. So I am not sure why we are talking about why was it granted. It was granted because it works, it is effective and efficacious. That's why emergency use authorization was granted.
Okay. All right. I'll let your question just flare in the audience, right? Your answer just flare in the audience, right there. I'll move on to my next question. All right. Following from the efficacy of the vaccine, as you mentioned that, yes, new technology, as I say, I'm a man of the science and technology. The vaccine, it was developed in roughly a year, and you said that, okay, because of the new technology, then this vaccine, it would have actually acquired the kind of attention that is needed for it to be safe for human administration. Now, being safe and effective for the short term does not necessarily mean safe and effective for the long term. Now, we know how clinical trials occur, right? And we understand how the human biology behaves. For instance, someone fall and knock their head, right? They may not experience glaucoma today. They may not experience glaucoma in a year, right? However, 2-3 years down the line, your eyesight may start going dark and dim. You understand what I'm saying? So my question is, how are we sure that going forward, after we put this substance into our body, and I'll call it a substance, because it's new as it relates to its component, right? It is new on the market as it relates to, it doesn't follow the common definition of what our traditional vaccine normally is, right? So how am I sure that later on I may not start experiencing some form of adverse effects?
So
If you
Mr.
understand my question.
Mr. Carter, you have placed a lot of things in what you have said. There are a lot of things that are less than accurate in what you have said.
Okay.
First of all, the components of the vaccines are not new. Sodium chloride, magnesium chloride,
I'm
the
speaking regarding
adenoviral
DNA
vector.
versus mRNA. Do not
I am,
deflect. Doc, you're deflecting at the moment.
Mr. Carter,
may
just
I
I'm
be
allow the
speaking
doctor.
regarding
allowed to
mRNA
answer?
versus DNA.
And
Mr.
so, sir, Mr. Carter, I gave
Yes.
you the courtesy of allowing you to speak without interruption. And I believe that that must be the least you can do. If you are here for us to share knowledge, then you've got to listen. So I was saying, sir, that the components of the vaccines are not new. The ingredients have been in use. The messenger RNA platform has been used over 10 years now, the development, so it is not new. With regards to the definition of traditional vaccines, we utilize various forms to make vaccines as I went through. You spoke to long-term effects, and the way vaccines work in the body, they do not normally over time leave any long-term effects, because what happens is that they stimulate our bodies to produce antibodies. So the messenger RNA, the viral vector, once that message is translated, those entities usually are disintegrated within 2 to 48 hours. They do not stay within the body. Okay, so that means that over time, in all the vaccinations that we have been doing over the 200 years, with all the technology as they become newer and newer, is that long-term effects never usually appear after 60 days, because the components do not stay within us. It is our own defense system that functions on memory.
Thank you, Dr. Ennis. Mr. Carter, I have muted you. Forgive me. I've given you two questions. You can keep your hand up. I'm going to engage some other participants, depending on how the time goes. If we still have time after I've given other participants to ask questions, then I certainly will come back to you. So you can keep your hand up, because I imagine you may have other questions that you want to ask, but I do know that there are quite a few other hands that are also up. David Jones, might I just ask you please to go ahead, make your comment, ask your questions.
Okay, good afternoon, everyone.
Greetings,
My
sir.
question, Doc, is in light of the fact that the hospitals are being filled up and so on, right? Are there any home remedies that persons can use? Because one would have the fear that I won't be able to go to the hospital. I might not be in a position to go to a private practice and so on. Are there any home remedies that you could suggest that persons could use just to stay alive, since we are unable? Might be the person don't have the vaccine, or even they were vaccinated but they have contracted the virus. What suggestions could you give in terms of home remedies?
Well, it is several things that you can do. And one of the primary things that we're, recommending for persons at home is to invest in a pulse oximeter. The pulse oximeter is a little device placed over your finger, and it tells you the amount of oxygen that is released into your body. And that figure must be, well, we love it to be 95% and over. Once it goes below 95%, it means that there is some compromise in our respiration. We also know that the virus lives in the upper airways before it gets down to the lungs. So it takes about 6 to 10 days in the upper airway before it gets down into the lungs, where it begins to replicate in an exponential way. So steam inhalation is also recommended. Remember when we were kids and got clogged up, we would do the mental thing with the towel over our heads. Yes, so steam inhalation is also important. Deep breathing exercises are also important as well, and these will help. Now, of course, we know all the other remedies that we have been using in the Caribbean from time immemorial. You have to build your system. You have your turmeric, you have your ginger, you have your lemon. Remember at the beginning, I said all these things help to keep us healthy. Vaccines are just one, it's just an addition to all of that. So all of those things can and should continue, sir, including, of course, eating right, sleeping, getting your adequate rest, and don't discount the benefits of sunshine.
Right. Thank you, Dr. Ennis. But just to clarify, if I may, are those to be used in addition to or as a replacement for the vaccine? Those remedies that you mentioned?
It is in addition to, it's complementary. It's not either or, it's together, all together. Yes, sir.
Okay, thank you very much, Dr. Ennis. Mr. Chambers, Gayon Chambers, going ahead with you now. It might be miss. I'm sorry. Again, I'm assuming sex and gender. Gayon, I'm trying to get you to unmute.
Yes, I'm unmuted. I'm a female.
Oh Lord, I'm so sorry,
that's
Gayon.
okay.
Forgive me. Forgive
That's
me.
okay. That's okay. I have one question that I've been asking from the last meeting. What about those who have already had the COVID and recovered? Do those people need to take the vaccine? And why?
Yes, Madam Chamberlain, it is important for those persons to take the vaccine as well, because they have found in the studies since last year that natural immunity gets less. It lasts for about 4 to 6 months when you have your antibodies present, but they get less over time, and persons have contracted the disease a second time and even a third time, and some persons die. So the recommendation is to take the vaccine at this time.
Okay, thank you very much, Dr. Ennis, for that response. Patrice Lewis. Patrice, asking you to unmute. Go ahead.
Good afternoon.
Hi, good afternoon.
Okay, my question, all the vaccines are the same. Why is it that the Pfizer vaccine is for the students alone? That one in particular. Why is it they cannot take the Astrozenica, the Moderna, and the others?
Right. And Dr. Ennis. Right.
What?
And Dr. Ennis, just before you come in, teachers, I have reopened the chat and you can go ahead and use the chat, but I must tell you that at some point we may have to close it down if again, we see that it is really just being used to spread propaganda, especially those things that Dr. Ennis has already spoken about, and especially if you're going to use the chat to disrespect the medical professionals, including the medical professional in the room. So we just ask you to be respectful of the science, of the persons who have dedicated their lives to study this thing, and to ensure that as you engage with each other, you'll be respectful of the fact that what you say here can actually cause persons to make poor decisions. So I've reopened the chat, but just be responsible as you share. Dr. Ennis, go ahead. I'm sorry.
Okay, so the reason why Pfizer is the vaccine that is being offered to children at this time is because children were part of the study in Pfizer. So remember, Pfizer was first out of the blocks. So usually when we are making medications, we do not do clinical trials initially on children or pregnant and lactating women. We wait until the medication is being used in the population, and we look at how the population responds. When we see that there's no untoward effect, we slowly lower the age and get that clinical trial in children and the pregnant women. So Pfizer was the first one out of the block. They vaccinated, inoculated hundreds of thousands of persons, saw no untoward effect, and then they lowered the age to 16. Remember, they did some trials now in persons 16 to 18, and those children were okay, and it was approved for them. As they continued to offer more of the Pfizer vaccines, they could now look at children. Now, other vaccines are in the process of doing trials on these younger persons, and Pfizer is still ahead of the game and looking at persons even younger than 11, but you cannot just give it to this population unless you have adequate data of its safety and effectiveness.
Is the vaccine mandatory?
The vaccines are not mandatory, my dear.
Right. Thank you, Dr. Ennis. And it wouldn't be Dr. Ennis who would make that decision with respect to the mandatory nature of the vaccine or a vaccination. Let me skip over very quickly to Mrs. Reed Williams. And again, I'm making assumptions about marital status. And oh Lord, Rhonda, I just lowered your hand. Forgive me. If you put your hand back up, I will quickly allow you to go ahead. That was a mistake, Rhonda. Let me then, while I wait on Rhonda to come back, allow Michelle Reynolds.
Good afternoon, everyone.
Hi, greetings.
Dr. Ennis, let me take this opportunity to say thank you again for such a wealth of information. I had taken the leap of faith. I really was listening to the anti-vaxxers, but then I decided to go ahead and do my vaccine. But my problem is, I did it in the United States of America. One other thing I recognize is that the card that I got, it was not stamped. How will I treat with this when I get back to Jamaica?
So you got both doses of your vaccine in America? You're fully immunized?
I took the Johnson & Johnson, so yes, I'm fully immunized.
So you're fully immunized. Well, there is a barcode. You have the batch number that is written in your card.
Yes.
You have the batch number, so, right? So if we plug that batch number into the computer, we can get a barcode in, and it can authenticate that you have been vaccinated.
Okay, so will I take this card to a particular place in order to plug this information in?
Yes, you can. You can come into one of the health departments. You should soon begin to track persons who have been vaccinated outside of country, so that we have a good idea of our herd immunity state. But yes, that can happen.
All right, thanks a lot.
You are welcome, my dear.
Yes, thank you, Michelle. Dr. Ennis, before I take another hand, there a question that has come up quite often in the chat is with respect to how long does the infected cells from the Astrozeneca and Johnson & Johnson vaccine dies after it delivers the code, that is. Our questions related to that. How long does it stay in your body?
So it stays in the body between 2 and 48 hours. And just to say that the cell is not infected, the genetic code goes into our bodies, and we produce antigens that stimulate the antibody response. There's no infection of our cells because there's nothing in the vaccine to infect our cells.
Okay. How soon after recovering is it safe to take the vaccine?
So there is no prescribed time after recovery. If you have the disease and you are asymptomatic, no signs and symptoms at all, but you must be in quarantine. You must be in quarantine, and therefore you wouldn't be able to take the vaccine until 14 days after you have outlived your quarantine period. Now, if you got very ill from the disease, some persons recover after 2 weeks, some persons 4 weeks, some persons 6 weeks. So it is once you are well, you can take the vaccine. So there's no prescribed time because persons get well at different rates.
Okay. All right, great. Thank you. And one more question, Doc, from the chat. And teachers, I'm ignoring all the questions and comments related to philosophies about vaccination and rights and so on. I'm not going to ask the doc to comment on any of those. I'm taking questions related to the science and to the medicine. One question is, if therapeutics are working, that is ivermectin, why is it not being recommended and used? That's Juliet James who's asking that question. Doc, you want to comment on that?
Sure. So public health measures and individual clinical measures are totally different things. So when a doctor sees a patient, they have an in-depth history, they understand what is happening to the patient and can make a recommendation for a particular medication to treat. And ivermectin is being used and it has been used. In some instances, there are positive results, in others, neutral, and some negative results. Now, for something to be a public health intervention, it has to be for the greater good. It's not a one patient at any time. And where vaccines are concerned, we're looking at preventing the illness, preventing severe illness, hospitalization, and death. When you use ivermectin, for example, you've had to be sick, you're treating, and your doctor will make a pronouncement. Now, not everybody who gets ivermectin recover. So we could not broad brush and say, use ivermectin on everybody because it is not reproducible in everybody. It doesn't produce the same effect.
Right. And before I go back to the answer that I raised, somebody has asked about varicose vein. Do you have any advice for persons with severe varicose veins, seeing that these vaccines may cause blood clots? And somebody on YouTube, and we want to shout out to our YouTube viewers, asked about the vaccine for lactating mothers.
Two very good questions. There is no contraindication to taking the vaccine if you have varicose veins. Varicose veins just really is an incompetence in the valves of the vein. So you kind of get pooling of the blood, and therefore you get the discoloration of the legs, and because the veins are distended. There is no contraindication. There is no increased risk of clots. You will continue to do what you normally do, wear your support stockings if you have bad varicosity when you take the vaccine. With regards to lactating women, as well as pregnant women, the evidence for the vaccine is limited because, as I said, the studies are just happening because of how we treat with these persons. But we do understand the method of preparation of the vaccines, and we know that the vaccines do not cross the placenta, and the vaccines do not get inside of breast milk. So the fetus is not affected, and the breastfeeding child is not affected. And when you look at the risks of a mother getting COVID, especially if she has comorbid conditions, she tends to get preterm babies or spontaneous abortions, or she may very well die. When you weigh those risks with the facts that we know about the vaccines, and once it is explained to the mother, then the vaccines are offered because the benefits way outweigh the risks, even without the extensive data being provided.
Okay, thank you. Thank you very much, Dr. Ennis. I know there are some other questions in the chat. Somebody's asking about chemotherapy for breast cancer. Should they take the vaccine? Suppose you have a pacemaker implant, should you take? But before we go to those questions, let me just take another hand, because these persons have been waiting patiently. Let me go to Sharice Kentley. Sharice, go ahead.
Hi, good afternoon, everyone. Doctor, my
greetings.
question is, I am fairly new to this information and I do appreciate it, but my question is that, do I need to go to the doctor and get a detailed checkup before taking that vaccination?
No, you don't need to get a detailed examination before you take the vaccine. You are well and healthy. There is nothing wrong with you. You are not sick. And once you are well, then you can take the vaccine. So there is no need. When we vaccinate, for example, the newborn with BCG, we don't do any checks. We just inoculate with BCG to prevent tuberculosis. So no, you don't need any check. Once you are well, you can take the vaccine.
Okay. All right, thank you, Dr. Ennis. For those of you who are asking for the YouTube link, if you are in the session here, it's the very same thing that's going on over there. But if you really prefer to view it there, then you can just go to the Jamaica Teaching Council's YouTube page, and it is being streamed live now. I know that a few persons are asking questions about the length of time for the trials and so on. I know Dr. Ennis spoke about that. And so I'm going to, in the interest of time, move on to other questions. If we have time, then we can perhaps take those questions. Teachers, I'm going to announce as well that we have been making some programming changes. We really were intending to have 3 presentations as the flyer would have indicated to you, but based on the significant interest in Dr. Ennis's presentation and the questions you have, we are now thinking of suspending those, postponing those presentations for another afternoon, and we just keep Dr. Ennis here for as long as she can stay with us, so we can exhaust the questions as long as she has time to stay with us. So let me go to Miss Ennis. Sorry, Miss James. Sorry, Dr. Ennis.
I like that you say you'll exhaust the person, but you won't exhaust me. That's interesting.
No, Dr. Ennis, we know you're indefatigable. We know that you, sorry, forgive me. I don't want to make presumptions, but as long as you can stay, and you perhaps, we're thinking you'd have been out of here already.
Oh, no, I'm good, sir. I'm good.
Okay, great.
At your service today.
Oh, look at that. Thank you for your grace. Let me ask Miss James. I'm sure it's going to ask Miss James. But let me go to Miss Jenkins. Dania Jenkins. Daniel.
Good afternoon, everyone.
Hi, greetings.
All right. Just to congratulate you on, the information today. I have taken my first jab, and some of the, the comments that I'm seeing in the chat from my colleagues, I am very disappointed. Yes, we do have freedom of speech, but we should remember that we are professionals. The thing that I am saying, we have been hearing the same thing and been asking the same thing over and over at different different meetings. The vaccine is not mandatory. I'm sure if it was mandatory, we would be having a different conversation. We do know that maybe that if you have underlying illness, you do know that they're asking you to go for it. If you have cancer, or the severe type of cancer and have to do radiation, they have been telling you to go to your doctor. So we have been hearing all of these stuff. So when we already know, so why are we asking the same questions over and over again? I had one Saturday, and a colleague of mine just passed away this morning. This virus is not a joke. I have been concerned about, the vaccine when it just came out, and I was saying, I'm not going to take it. I'm looking. But when you have been hearing, it does not prevent you from getting the virus. It prevents you from going on a ventilator. Westmoreland have been running out of bed space, literally bed space versus a big chair. My colleague was in a with students, looking at his hand, I'm looking at their teacher dying there. It is not a good look. So colleagues, please stop asking rhetorical questions and be professional, and you know the answer to these questions. We are not mandated to take it. They're asking you. Yes, some countries are doing that, but please, colleagues, come on board. We need to get back to our children. Our children are suffering. I have 4-year-olds, and trust me, they don't have devices. We are going out of our way to get them educated. So please, come on board, take the job. They are not going to chip us and anything like that. We are not doing gene testing because it's not changing our DNA or letting ladies not have any babies. So we all know these myths going around. Yes, you can express yourself, but please do not come to these professional functions and putting out your myths. If you don't know, say you don't know, but please do not spread lies and try to make problems. If you know the information already, just stop spreading the fake information. We have been scared enough. We have been too scared and our children are suffering. So please, if you're sick, you have underlying illness, speak to your doctor, get your checkup, ask professionals about the vaccine, but please do not come to these, functions and spread your lies. I'm looking now to take my second job in about 3 weeks. So please, colleagues, come on board and get on with it. Get vaxxed.
Yes,
Thank you.
Thank you, Dania. Thank you for those words. And teachers, we certainly wish you would raise your hand and ask your questions in the chat, and even raise your hand if you wish, if you have questions, and if there's something you want us to try to clear up for you. But I want to stand with Ms. Jenkins and just ask you, please, if you know that you are, if you just be careful of what you say. There are persons here who are anxious to get information, and you don't know who you might be misleading when you carelessly spread misinformation. So just be careful, guys. We are still asking you to be responsible, even as we give you an opportunity to speak. And so absolutely, if you have a question, raise your hand. If you want to put a question or a comment in the chat, we welcome that. But we do ask that you be responsible as you engage in this space. So thank you for that, Ms. Jenkins. And I sympathize with you I empathize with you as you worry about your 4-year-olds and how you're going to engage them come September if face-to-face is not a reality. Miss Rhonda Reed Williams, I'm sorry, I know I lowered your hand before. I'm giving you a chance now. Go ahead.
Thank you, Mr. Leslie. Dr. Ennis, earlier in your presentation, you mentioned briefly about who would not be a good candidate for the second dose. You were mentioning about the severe allergic reactions. I wonder if you could elaborate a little on that for me. I've taken my first dose and it was quite fine. My husband, on the other hand, had some very severe reactions, and I want to know a little bit more about whether or not he's eligible for the second dose of the AstraZeneca. Thank you.
Okay, but before you say thank you, could you just give me a synopsis of what happened to your husband, please?
All right, so he took the AstraZeneca on Friday, and he had high fevers Friday, Saturday, Sunday, pain in his legs, terrible headache, pains in the back of his neck, dizzying feeling. Now he's having like a cough, like a cold, mucus producing cough. So, we are a little, not to say worried, but at this point thinking, so I would love some additional information as to how to proceed with these, what should I say now, symptoms that we have noticed since Friday.
Okay, thank you very much for that.
Thank you.
You said Friday, so I believe we're at 5 days.
Right.
So we are a little outside of that window of 3 days when we would have expected everything you said. The fever, the pain, the headache, the dizziness, the cough, the productive cough. We would have expected all of that. But he is outside of the 3 days. And because he is coughing and because it is productive, I want him to certainly go and do a COVID-19 test.
Okay.
Because it is possible that he may be COVID positive, or he may just be having another viral infection. But to err on the side of caution, I would advise that he gets and because he's symptomatic, he can, excuse me, because he is symptomatic, he can do the antigen test for starters, because the antigen test, it is more accurate if you're having some symptoms at all. So that would be my first suggestion. And then he certainly have a discussion with his private physician. Thank you.
All right. Thank you, Doc.
You're welcome.
All right. Thank you, Rhonda. Doc, a question that comes up quite often in the chat here and on YouTube, it comes up in various forms, is the interaction between being COVID positive and taking the vaccine. Some people are asking, do I need to be COVID negative to take the vaccine? Should I do a COVID test before taking the vaccine? What if I take the vaccine while I'm positive, and so on? Could you just say a few words on that to address some of those questions?
Sure. So if you have the virus and you are asymptomatic, so you don't know that you have it. That's what that means. So if you have the virus and you don't know that you have it, it means that you are well, and therefore you can take the vaccine. Now, if you are sick, we do not vaccinate sick persons. The vaccines are not therapeutic. They are not treatment, which is what some persons have, I don't know why, but they're sick and they have masked the symptoms. So they'll take their Panadol and their cough mixture and their fever medication, of course, and they'll come and take the vaccine. The vaccine is not going to change the course of the disease. So if you are sick, it is going to carry through. Whatever will happen is still going to happen. And therefore, we beg of persons not to mask the symptoms. If you have, just like when you carry your kids for vaccination, if the child is vomiting and have a high fever, nurse is going to tell you to wait until the child is better, right? So it's the same thing. If you are asymptomatic and have the virus, you are well, and there is no untoward effect at all. And as with other vaccines, we don't test you before. When you carry your child to get measles, mumps, and rubella, we don't test them for those things. When you get polio drops, we don't test you for it. So we don't test before we give to well persons. If you are sick, you wait.
All right. Thank you, Doc. Let me see where I'm going next. Ashika Wade, go ahead. I'm jumping over to YouTube to see if there are new questions over there. Ashika, asking you to unmute and go ahead.
Good evening.
Hi,
this
good
is
afternoon.
my first meeting like this, right? So I have kidney problems. I know that they were saying talk to your physician and all of that. But since I'm in this meeting, that is the reason why I'm scared of taking it, because I have kidney problems and I don't know if I should take the vaccine, yes or no. So that is my question. Is it okay for me to go ahead and take the vaccine with kidney problems?
I am going to say yes, it is okay, because the vaccine is not one of the medications that is detoxified by the liver and excreted in the kidney. It doesn't work like that. It is our own bodies that will make those germ fighting tools. So it will not affect your kidney in any way. No.
Okay, thank you.
Of your kidney and you're on antibiotics, which means you're sick, I'm going to ask you to wait until you have completed that course before you take the vaccine.
Oh, so I can't take it while I'm on antibiotics, because I am on antibiotics right now.
So I'm going to ask you to wait until you have completed your 10 days or 7 days of antibiotics before you take the vaccine. Yes, ma'am.
Okay, thanks.
You're welcome.
Right. I know that I saw while you're speaking about treatment and vaccination, I know somebody has asked repeatedly, JAD education, if someone is undergoing chemotherapy, treatment for breast cancer, should they take the vaccine? If so, any specific one? I guess. Okay. Go ahead,
All right.
Doc.
So let me try that one. It depends on the chemotherapeutic agent you're on. If you are on an intravenous IV medication that is immunosuppressive, we ask that you wait 14 days between your IV therapy and the vaccine. All right. But if you're on oral medication, then you can take the vaccine. But if you are in active treatment, we do recommend that you have that conversation with your physician. And it does not matter which of the vaccines, all of them can be used in situations like that.
Okay, thank you, Doc. And teachers, I'm seeing the comments in the chat. I know that you have more questions, but again, and I'm going to be unapologetic about this, the Teaching Council will not provide a platform to spread misinformation. We will ask you to engage with the doctor in any way you want, but we certainly do not want you to simply spread misinformation in the chat or to be disrespectful to medical professionals in the chat. And to be frank with you, this is something that I am unbending on. And so we are not apologizing for asking you to refrain from being disrespectful and to refrain from spreading misinformation. If you want to ask a question or to make a comment about a concern you have, then absolutely we can take your questions either in the chat or you can raise your hand. I'm going to take Mr. Grant, Kevon Grant. Again, I'm making assumptions about sex, but go ahead, Kevon Grant.
Yes, man, it's Mr. Sir.
Yes.
Dr. Ennis, I doubt you remember me, but my vaccine is here and I am excited. And I want to publicly thank you. You have answered a lot of my questions and I've learned a lot. I just have
welcome, sir.
I just have a couple more.
Okay.
And perhaps you tell me if I have to find.
Oh, I remember you. I remember you now. Yes, I remember. Yes.
So there's one thing that I'm unsettled about, and you can probably help me to understand it. I watched a program on TVG. I think it was Sunday night. I don't remember the doctor's name, but he seemed to suggest that the way the vaccines work, he used the analogy of killing them when you do get it, because we know you can still catch it. But he suggested that the vaccine would kill them as they enter the host or the vaccinated person. And thus, well, logically, I agree, it should have an impact on transmission. But at the same time, you and I and World Health Organization still are not convinced that there's enough data to suggest it impacts transmission. Could you explain why perhaps some persons are convinced it impacts transmission, and others?
Well, the studies are beginning to come out, Mr. Grant, that the vaccines do affect the burden or the volume of virus that is within the respiratory tract. When vaccinated persons are infected, there is the killing by our germ-fighting agents or antibodies that reduces quickly the number of the virus that is there, and therefore the amount of replication is less than in an unvaccinated person that don't have the ammunition ready to kill. So the studies are showing that disease burden is less, and therefore they are extrapolating that infectivity is going to be less in those persons. And the vaccine that is actually coming out on top so far is actually Astrozeneca, that it really lowers your burden, disease burden, and you will spread it less. But the evidence is not full as yet. We continue to follow the science, but it is looking as if persons who are fully vaccinated with AstraZeneca spread the disease less.
Okay, two more and I shut up. I was reading the what they call it, the recommendation background on the website, and they suggested that these I don't remember who shared that their husband was having the issue, but usually, typically with the Pfizer vaccine, after the second dose, the studies show that the younger persons tend to be the ones who, quote unquote, have these adverse or more severe reactions, although they tend to resolve over time. It is, what I'm not clear on is that it used the term BNT something another, B1 as opposed to B2. Would you be able to explain what the difference is, and if that's the reason why they saw that data coming out of the trials? I think it's some coding name for the particular vaccine.
Or it's a coding name for the variant. I'm not sure what you're talking about, because you don't have the name. But Mr. Grant, you know where to find me. Mr. Grant, you know where to find me, and you will email me and ask me your question. So we can have that discussion when you tell me exactly what you're speaking about.
All right, Miss. I'll reserve the last one then.
All right. Thank you so much. Back over to you.
All right, thank you, Sir Grant. Thank you, Sir Grant. Mr. Carter, I see we'll be able to come back to you because I see Mr. Dillon's hand. I'm going to allow Mr. Dillon now. Mr. Dillon, Kesreen K. Dillon.
Good afternoon. Thank you so much, sir. Doc, in my household, I'm fully vaccinated. In my household, for some reason, we have taken 3 different vaccines. I am curious now to know, are we going to need boosters for them?
We are not there as yet, Madam. We really don't know if we are going to need boosters. We are dealing with a virus, and if we look at the family of viruses as well as those that cause influenza, for example, we know that they undergo change, the mutation, the shifts and the drifts, and these happen over time and quickly. And therefore, if we were to mirror it of influenza, we may need to take a shot, for example, every year, but we're not sure as yet. The science is not there yet. Persons keep asking about booster shots. You have to take the first 2 shots first. You have so done, and you are protected now, and you will be advised if you need a booster shot. I just want to say also that booster shots and repeated in a sequence is not anything new to vaccines. I believe that BCG might be the only vaccine we take one of. We do get several drops of polio, several shots of DPT, even tetanus. We get booster shots after every 5 to 10 years. You have to get a booster shot. So it's not anything new because our memory cells do get less, and we need to, as it says, boost our immune system. But at this time for COVID, we don't know.
Right. Thank you, Mr. Dillon. I know too that there are some questions in the chat with respect to having various illnesses and taking the vaccine. I think Dr. Ennis has spoken to, if you are ill, you are not going to take, you won't be vaccinated. But I know there are some other questions, Doc. Suppose you have a nervous condition. Suppose you have lung cancer and so on. Again, can you just speak a little bit more about being ill? Maybe not ill and symptomatic, but you have an illness that you are treating, that you're living with.
So if you have a
Mr. Leslie, Dr. Ennis, also lupus. That's in the chat.
All right.
Right.
Sure. No problem. So if you have an illness that you are living with, if you have an illness that you're on medication for, yes, you are to take the vaccine. When we speak to being ill, we speak to being acutely ill, okay? So you have a rip-roaring infection at this time. Yes, that is what we're speaking about. If you have lupus, if you have multiple sclerosis, if you have heart problems, angina, if you have asthma, yes, you can take the vaccine. So it is the underlying conditions that you are living with that you are to take the vaccines. We only say if you are acutely ill, then you should not.
Okay, thank you. Thank you, Dr. Ennis. I hope that has helped those persons who I know have questions about taking the vaccine with their illness. I see 2 hands still being up. There is Mr. Carter and we have Donna. I'm going to go to Mr. Carter first because his hand has been up for a while and he has been holding. I know he had some follow-up questions. Mr. Carter, I'm going to give you a chance to follow up with 1 or 2 of the questions you have, and then I will up over to Donna, who I am sure is going to do a benediction for us. Mr. Carter?
Yes, greetings again.
Indeed.
So Doc, my respects goes to you and in your profession, right? Just understand that, please, that my questions aren't in attack, in a mode. I'm not in attack mode. I'm actually in an inquiry mode, right? There are a lot of concerns that I have, which I really do believe I would love to have with probably someone like you face to face, I don't think that this platform will suffice for everyone to be able to get the information, get the questions that they need and acquire the information that they actually need to say, okay, I am making an informed decision why I need to take the job. Now, instead of going all the way back to what we're speaking about, there are a bunch of concerns that I have, things that I've noticed on my own, because I'm actually a researcher, right? Both by profession and by nature, right? And I've observed some things happening online, and this is what piqued me. It's not a case when I've been following the many conspiracies around there that's going on around us, right? Since this is on YouTube, I'll try to censor my own speech, since YouTube has been censoring information online.
Mr. Carter, to be frank, we're almost at the end, and as much as we want to give you a chance, I really wouldn't mind if you would be prompt with it. We really want to try to get through a few more questions. So if you could get to the question quickly, I hope you don't mind.
All right, I think I'll just pass.
Meaning you don't have a question anymore?
No, I'll just pass. This cannot be done on this platform.
Okay, all right, no
I have
problem.
some very genuine questions, and
so we wouldn't mind if you ask those,
like
though. So do you have a question you wish to ask? One of those very genuine ones?
No, it's all right.
Okay, all right, no problem.
I think you muted yourself, Mr. Leslie.
I don't know. Sorry, I meant to unmute Donna. Donna, sorry. Go ahead, Donna.
Good afternoon, everyone. Great presentation. Just two quick questions concerning lupus.
Yes, ma'am.
Do you have to stop taking the lupus medication for a while, before, like 2 weeks, before you can get the vaccine? That's one. And secondly, within a household, you have other members of the family are vaccinated, but a child under 12 who cannot be vaccinated right now. Any special precautions have to be taken with that situation, seeing that you can get the virus and pass it on when you're vaccinated?
Well, remember that there is the vaccines do not give you the virus. So your chance of passing on the virus would be the same with or without taking the vaccine. And as such, you just need to maintain the protocols of, the physical distancing, the hand wash, hand sanitizing, and that should do. So there is no increased risk because you are vaccinated that you are going to infect your child at all as a result of the vaccine. Now, with regards to lupus, if you are, if you are stable on your medication and it's routine, then there is no need to stop it. But if your medication for lupus is immunosuppressive and IV, then you would need to stop it. But again, if you have those concerns, you've got to talk to your doctor. But in general, with lupus on routine medication, you can take the vaccine.
Okay, Donna, I hope that helped. I know I saw another hand, but before I go to that other hand, somebody really has been trying to ask Doc, vaccine choice. Do we have a choice as to which vaccine to take? And somebody even messaged me outside of this meeting to ask if, meaning to my WhatsApp, to ask if there's one that you recommend over any other.
No, I do not recommend any over the other. All the vaccines that we have here in Jamaica now have been approved by the WHO for use. They're all effective. They're all efficacious. So there is no one that we will recommend over the other. There are some, however, that we give to a population, for example, the homeless population. If we are going to be inoculating the homeless, it would be easier to utilize a one-dose vaccine because we might not find them again on the road. If we have persons with certain mental conditions that are unstable, it may be easier to inoculate them with a one-dose vaccine. All right, so you will hear that there are some priority groups, but all the vaccines do what they are supposed to do, prevention of the severe illness. And of course, the only one that I'm going to recommend for children at this time would be Pfizer, because that's the one that is available for them. So no special recommendations, but we do have groups that we will give one or the other vaccine to.
Okay, thank you. Thank you very much, Dr. Ennis. I'm going to put a link in the chat, guys. Mr. Grant just shared it with me, and I've just kind of glanced at it. He said in the chat to me that it helped him, or these links helped him as he sought information about the vaccine, and he's sharing it with me so that I can share it with you. So I've put a link in the chat that you perhaps can look at if you have questions about the vaccine. And I suppose if you're prepared to read with an open mind to understand. 2019, we are coming down, guys. It's 4 o'clock. We're wrapping up. 2019. Asking you to unmute your hand is currently up. You perhaps don't know that you are 2019 because that's an odd name, isn't it?
You hearing me now?
I'm hearing you clearly, sir.
Thanks for having me. I just came on, Charlie. I want to know one fundamental aspect of the whole notion and the practical of being vaccinated. What's the purpose of being vaccinated against a virus or a disease, whatever you guys define it as, if you still run the risk of contracting the disease and you still have to follow the protocols that you have been following from March 2020 in Jamaica? What's the purpose of being vaccinated?
Well, sir, there is no medication at all that is full 100. I am sure you are well aware of the bell curve, that the majority of persons will fall within the peak of the curve, but there are always outliers. So whatever you take, whatever you do, there are going to be persons.
But based on...
Yeah, I finished, sir. Please.
Sir, just allow Dr. Ennis. I'll come back to you in a minute. Go ahead, Dr. Ennis.
So there are persons who will get ill because nothing is full 100. However, the purpose of the vaccines, sir, is to prevent severe illness, hospitalization, and death. That is why you're taking the vaccine. If you're, for selfish reasons, for starters, to prevent severe illness, to prevent hospitalization, there's no hospital bed for you, either here in Jamaica or in foreign. There is no ventilator at this time. So it prevents that and it prevents death. I believe, my personal opinion now, that is a strong incentive. The other greater good reason for taking the vaccine is that if we are not allowing the vaccines to take root in us, which means that they get into our cells and replicate plenty, and when they do replicate, they form variants, and the variants are more difficult to treat, and the variants can cause death, then we do take the vaccines for that reason. Now, we will be able to not wear the mask and go back to normal, some sort of normalcy, if enough persons in the population are vaccinated, so that when the virus bounces from me onto Mr. Leslie, onto you 2019, the virus cannot survive, it cannot replicate, it will lessen the burden in the society. But that will only happen if all of us are vaccinated. If not, it will have a chance to take root and spread even more, causing more variants, even though you who have taken the vaccine may not die. Please go ahead with your follow-on question, sir.
2019, I'm giving you permission now to unmute if you wanted to follow up with a question.
Yeah, are you hearing me now?
Yes, we're hearing you.
So is it a case where the variants are coming from the unvaccinated person, or it's coming from the vaccinated persons?
Sir, can come from anyone who can spread the disease. The point I'm making is that if you are vaccinated, the chance of your having the virus replicate inside of you and form variants is much less.
Well, thank you. Thank you for clarifying that, Dr. Ennis. And teachers, again, I apologize. The program that we had planned for you, I promise you, was far more comprehensive than one about vaccination. We should have known better, though, that this issue would have occupied the entire session. We should have planned knowing that this could not have taken place in the 1 hour that we had scheduled for it. And so I apologize if you had come intending to hear some discussions about making school safe for teachers, not just about vaccination. We have made a few programming changes, seeing the significant interest in the presentation that Dr. Ennis had made, and just giving participants a chance to ask their questions. We took a decision that we would suspend the other activities from this afternoon. And so we're going to be indicating to you in short order when we will be engaging again. I am prepared to say at this point, though, that next week, Wednesday at 2, unless we tell you or until we tell you otherwise, next week, Wednesday at 2, we will be engaging again with the remainder of this afternoon's planned activities. The link that you have now and the meeting details that you have now for this meeting, we will use those same meeting details for next week, Wednesday at 2. At any rate, we will send out another reminder before Wednesday of next week, letting you know precisely when and how and so on you can join for the other presentations that were scheduled for this afternoon. Again, we apologize. We really had intended to make this session being more than about vaccination, but your interest in the activity and certainly the way our Dr. Ennis would have spurred your thoughts and your own thinking would have required that we stayed longer than we intended. We apologize, and we do hope you can join us next week when we engage with the other sessions that were planned for this afternoon. Is there any final question, any final comment? Anybody who wishes to make any last benedictorial comments? We are not here trying to extend it any further. Let me ask Dr. Ennis, do you have any final comment that you want to make? Can we take essential zinc and other vitamins after taking the vaccine to boost the immune system? I think Dr. Ennis has said that. Well, let me not answer for her. Dr. Ennis,
Yes,
essential zinc?
Yes,
Yes.
all
Yes, the brief answer is yes.
the calcium, the garlic, all of that. Yes, you can continue.
Okay, I see 2 hands, Dr. Ennis, and teachers, I'm telling you that these are the last 2 hands we will take. And Maureen and Dawn, we really are hoping that these comments are summative and benedictorial. And I hope you know what I mean by that. We're really trying to wrap this up now, yes?
Good
Maureen, go ahead.
Good afternoon, Mr. Leslie. Good afternoon.
Hi, greetings,
Dr.
greetings.
Ennis, colleagues, all, good afternoon. I'm just really appreciative of this effort this afternoon and all the information that has been presented and has been laid out for every one of us, to clarify and to, kind of give us, some, to get us to make a decision as to where we go as it relates to taking the vaccine. My mom is here with me and she's listening in, and she appreciates she appreciates all that she's hearing. So I am really grateful this afternoon for this forum, for this, the way in which the information was presented. We know that we all are scared to death and scared of everything. But then, when Dr. Ennis, makes his presentation, it makes things a lot clearer for us. So thanks again, Doctor. Thanks, Mr. Leslie.
Thank you so much, my dear. Thank you.
And Dawn, that was a great example, Maureen, of being summative and benedictorial. Dawn, let me just allow you now to definitely show that you know how to be summative and benedictorial as well. Go ahead, Dawn.
I am not sure that this is either summative nor I just want to ask my question.
Okay.
For a while, but it was not recognized. I have been in 2 meetings this afternoon, unfortunately, because the Early Childhood Commission, the Jamaica Teachers Association, all of everything is just, just a lot of workshops. But anyhow, I want to find out if someone might have, it's not confirmed that you might have an illness such as cancer, lupus, or something like that, can you still go ahead and take the vaccine?
Confirmed meaning you're ill now and you're waiting
Not
on
really
the final
ill, but-
diagnosis?
Yeah.
If you're ill, remember, colleagues, ladies and gentlemen, if you are ill, we are not going to vaccinate you. So if you are in the process of waiting on a diagnosis because you're sick, you're not going to get the vaccine. We're going to wait until you get better.
Oh, what if it's, you're not down, with illness, you're just not feeling yourself, or, and you suspect that something might be wrong and you're not really down,
So you are going to, if you feel down, you're going to seek medical attention to figure out what is going on. And once that determination is made, you will know if you can or cannot take the vaccine.
Okay, if someone has cancer, lupus, any of those, can you take the vaccine?
Yes, you can take the vaccine if you have any of those illnesses. Yes, you can.
Thank you so much. For children who are supposed to be taking the vaccine, is it those children over 12 who are comorbidities, or just children over 12 in general?
It's all of them at this point, children over 12.
Thank you so much.
You're
All
welcome
right.
so much.
Yes, thank you, Dr. Ennis. I'm just going to give you a final opportunity to make a brief comment, if you wish, before we dismiss.
I really just want to thank you, Mr. Leslie. You have been quite a gracious host. I want to thank all the persons who turned up on this platform. This dialogue would not have been possible without the fulsome participation of everyone. I know that there are persons among us who are convinced that they will not take the vaccine. I am not here to change your mind. If you know you will not take the vaccine, then that's fine. I am here to simply provide information for those who crave knowledge so that they can make a decision. If I know myself, if I have decided I'm not doing something, then it matters not what anybody say to me. And therefore, I personally wouldn't bother to turn up to these sessions because I don't make up my mind already. But it's really just to provide information, to share, and to understand some of the root causes of why people are hesitant, and to bring information as I know it from the science to you. I want to thank you for your participation. Let us all remain safe, ladies and gentlemen. Wearing the masks properly, covering the nose and the mouth, hand sanitize, physical distance, stay socially connected. Let us get Jamaica back together, please. Thank you all so much. Have a good one. Mr. Leslie, over to you.
Yes, thank you, Dr. Ennis. You are a star, I tell you. Absolutely a star. Let me just thank you on behalf of the Teaching Council, on behalf of the teachers of Jamaica, for being with us, for staying with us so long, and for being so patient with us, and for taking the questions that you have taken. I really want to thank you, and to just indicate to you that you are now a friend of education, and we are claiming you. We are claiming you as an educator. We are claiming you as a teacher. After this afternoon session, you certainly must be a teacher to have demonstrated such patience as you engage with us. So I really want to thank you for that. Mrs. Solomon, I'm about to dismiss, but I suppose I want to just give you a final chance.
Before your benediction, I want to offer my own thank you to Dr. Ennis. Absolutely a wonderful presentation. And I agree with Mr. Leslie. We are so saying that you're a part of our fraternity. Also want to mention that the Chief Technical Director, Maureen Golden, Minister of Health, is on. We Ministry of Health, Ministry of Education, working together always, right? We are in this together, and so together we can. Just want to say to teachers that you can follow the Ministry of Health and Wellness on their Twitter, on their social media handles too, because that's what I do. And that's why, Dr. Ennis, this would not have been the first time I'm listening to you at all. And I always admire the way you manage to answer all the questions. And so teachers follow Dr. Ennis, and I do want to point out Mr. Carter and the others who need one-on-one. Reach out to your medical professions. We all know the doctors, we all know them there. If you need someone from Ministry of Health, just email any one of us at the Jamaica Teaching Council. We will help you to get in touch with any persons in the Ministry of Health and Wellness, because you may need that one-on-one. And we do agree that this may not be the place to get your questions answered. You have so many of them, and they need to be answered. So thank you for coming. Look, I want to thank Mr. Richard Troop for being on for 2 hours and coming back next week. He has agreed to come back next week. And Miss Halsam, our teacher from Trelawney, who we're talking about student engagement, want to thank them for giving up to this most pressing situation. This certainly talking about how to be safe, and the most pressing matter of hand is COVID. So thank you all, and over to you, Mr. Leslie, for the benediction.
Yes, thank you. Thank you, Mrs. Solomon. Teachers, as we come to the end of this session, let me thank you for being with us. The truth is the Teaching Council exists to serve you, and we are always so pleased when you respond in the way that you do to these activities. We're aware that there are competing activities going on, and you always find the time and see the need to engage with us. And so we thank you for being here with us and just allowing us to exist to serve you. Remember to stay on top of your emails. We do send you lots of emails as we tell you about these activities, but we also want you to follow us on Instagram, follow us on Facebook, because we also use those platforms to share information with you. Our website is also active. You can go over there, and we also use that as well to share information. But certainly, absolutely, the video this afternoon is already on YouTube. If you wish to go and rewatch, if you also want to share it with your colleagues at work, then certainly we invite you to do that. And we think that these conversations that we are having here are conversations that you should be having within your personal space and in your school and your school communities. So we ask you to consider reaching out to your medical professionals to have these conversations in a more personal way as you move forward. Teachers, above all things, we wish that you remain safe. We wish that you will take all the precautions that you can take to ensure that you are always well, that your loved ones are well, and that you also consider your mental health, as a part of being safe. We are going to end the conversation now, but again, we thank you for being here, and we encourage you to share the news about the Teaching Council with your colleagues so that our reach can even be greater than it is now. Have a great afternoon, teachers, and we will talk anon.